Hi there, I'm Alex Smith. I'm a senior nursing student here at Mennonite College of Nursing.
And I'm Miranda Matheny. I'm also a senior at Mennonite College of Nursing. We are sim assistants here in the lab, and we do a lot of different jobs around the lab. But one of the things we are part of is the Simulation Lab Day.
What the Simulation Lab Day is it's going to be something that you're going to have for the first time with your first semester. It's going to take place on one of your clinical days, and basically what it does is it puts together a lot of the things you've learned in theory in your specific Adult 1 course. And what we do here is you come in, you get divided into groups of 4 with your peers, and then when you get into your room, you are given a specific note card with a specific role, which can vary from your primary nurse, secondary nurse, a nurse tech, or even an observer. And then with your clinical faculty in that room, you kind of go over the S-bar, so you get a little bit of an introduction as to who your patient is, what's going on. And then you run a 20-minute scenario, and basically you're the nurse, and you try and put everything together that you've learned in theory and try and basically figure out the problem of what's going on. At the end of this video, Miranda and I will go through a small scenario, kind of give you an intro, an introduction on what to expect.
One of the wonderful things about sim is that mistakes aren't fatal here like they can be in the real world. Even though no one gets hurt here, it still can be embarrassing if you're not sure what you need to do. One of the best ways to avoid stress like this is to properly complete your ticket-ins prior to coming. The first couple ticket-ins I thought were kind of like busy work, but I soon realized that taking them seriously was vital to a low-stress and fun sim day.
Put your heart into it. Fully and accurately completing it will almost guarantee that you'll be prepared for the scenarios that day. Pay particular attention to the objectives you will find on the form. They will tell you exactly what the faculty is looking for. Complete it with enough time in advance that where you can go over it and review it a couple times before your sim day. Believe me, the best way to decrease the anxiety that some of us feel about sim days, especially the first ones, is to be prepared. Earlier we had mentioned that there was going to be a scenario that we were going to run to show you what to expect in your sim day. For your sim day, every simulation will start off the same way. You'll have your instructor either at the nurse's station or preferably at the bedside. They will give you a report on what to expect in that simulation. For our scenario now, our patient is sleeping, so I'm going to be the night shift nurse leaving, giving report to Miranda, the nurse coming on the shift. It's 7 o'clock in the morning. Since she's sleeping, we'll do it at the nurse's station. The patient is Martha Elwood. She's 60 years old. She's in room 101. Her reason for admission: Mrs. Elwood fell yesterday morning after stating she had fainted and broke her right wrist. She had an open reduction internal fixation of the wrist yesterday afternoon, which went well, but there was some trouble controlling her blood pressure and some concern with her fainting spells. And they are concerned that her fainting may have been a TIA. Her blood pressures have ranged from a high of 200/96 yesterday before surgery to 160/92 this a.m. at 6 this morning. Dr. Murphy has increased her lisinopril from 10 to 20 milligrams daily and added metoprolol 50 milligrams TID last night. She had one dose last night. Pain has been well controlled with the last PRN dose of hydrocodone 10 milligrams at 5 this morning. She has a history of hypertension that's been poorly controlled. All of her tests, yesterday she had a CT scan of her head, which showed nothing, it was negative. She is allergic to penicillin. As for her vital signs, at 6 o'clock this morning, her blood pressure was 160/92, heart rate 86, respiration 16, temp 36.9, and SpO2 98% on room air. Her pain is a 7 out of 10 before the hydrocodone, and 3 out of 10 an hour later at 6 this morning. She has a 20 gauge IV in her left forearm, saline locked. Her wounds and dressings: she has a cast to her right forearm, dry, intact with no drainage apparent. Her right fingers are warm with good sensation, nail beds pink with rapid capillary refill, only mild non-pitting swelling of fingers noted. She is a high fall risk, ambulate with assist of 1 when out of bed. Her bed alarms are on. During my shift, I was taking blood pressures every 2 hours. I recommend you do the same until her blood pressure stabilizes. Also, I'd recommend you give her blood pressure meds as soon as they show up on the MR.
Okay.
Okay, so now we can go introduce you to Mrs. Elwood. Good morning, Miss Elwood. I'm here to introduce you to Miranda, your day nurse.
Mrs. Elwood, you might start taking her blood pressure.
Yeah, I can do that.
Mrs. Elwood. Hi, my name's Miranda, and I'm the nurse that's coming on. Is your head hurting? Yeah? Okay, we're gonna go ahead and
Here,
start
so let me
taking your
take
blood
that.
pressure. And I'm gonna do an assessment on you, okay? I'm gonna look into your eyes. Can you stick your tongue out for me? Alright. Can you tell me what your first name is?
Yeah, she
Okay.
wasn't like this yesterday. Her blood
Okay.
pressure is 210/100.
Alright, yeah, I think her condition's definitely changed. Can you go call Gray for me?
Yeah, I can do that.
Okay, so Alex is gonna go call Gray for me. And that's just calling other people in, and they're gonna help us assess you a little bit better, okay?
Code Gray 101. Code Gray 101. Code Gray 101.
So he's just notifying them, and they're on their way now.
Hello, my name is Amanda Nimmo, and I am a graduate assistant here at Mennonite College of Nursing. We just compressed what would normally be a 20-minute scenario into 3 minutes to help you understand in a very time-efficient way what you can expect when you run a scenario in the sim lab. Please keep in mind that your scenarios will unfold much more slowly. The complexity of this scenario is one that we would normally see for our senior students, so don't be overwhelmed. We used it because it was one we could quickly move through the components of a scenario. The S-bar you heard Alex give Miranda in the beginning is normally what your instructor would be telling you in the room prior to the start of the scenario. In Adult 1, we will actually give you a fully filled out S-bar that you can use as a resource during the scenario. S-bar stands for situation, background, assessment, and recommendation. If you listen to Alex's report, you will hear all 4 components of the S-bar. Once they entered the room, you saw them do hand hygiene and introduce themselves to the patient. When the patient did not respond in the way they expected her to, they immediately kicked into a focused assessment given her history of high blood pressure and recent unexplained fainting. They used the assessment tools available at the bedside and checked her pupils for unequal size, did a blood pressure reading, had her stick her tongue out, and checked her speech, all assessments for a possible stroke. Due to her broken arm, they deferred checking bilateral grips or having her raise her arms. Given the results of the assessment, they suspected a stroke. They communicated vital information with each other, Alex letting Miranda know the blood pressure reading, and that there was definitely a change in the patient's condition. Hopefully you noticed how Miranda, as the primary nurse, directed Alex to check the blood pressure and then go call the code gray. Primary nurses in these scenarios are expected to direct other staff in the needed interventions in a professional manner. Once Miranda sent Alex to call the code gray, you will then note that she stayed with the patient, reassuring her as well as monitoring her condition. Communication with the patient will be a big part of your role in the scenario. Whether the patient is a real person like she was in this scenario or a mannequin, which the faculty will talk through. Once the scenario is finished, you will debrief with the person running the scenario. You will be asked how you felt about the scenario, what you felt went well, and what you felt you could improve upon. You will discuss what goals you had for the patient and whether they were met. Remember those objectives that Alex and Miranda told you were so important in the ticket in? You will review them to see if you met them or not. And you will be encouraged to share the things you learned that you feel that you will use in your practice. We hope you're looking forward to your first day in the lab. When asked on a survey what a student learned in their first sim day, they replied, "I learned so much I can't put into words. It was an amazing experience that I am thankful for. I learned how to put what I've learned together and help a patient." We hope your experience is just as wonderful.